Hey guys, today we are doing an awake brow lift, which is a procedure that surprisingly can actually be done in the office. So I want you guys to just take a look at something here. See how she has this crease right above her brow? That's a dead giveaway that a brow lift is necessary. People will come in and they're like, I have heavy eyelids, you know, let's remove this skin. Raise your brow. And then if they have this line, that's just a dead giveaway. We need to actually be doing this. If we lift the brow, it almost looks like, you know, we gave her that eyeshadow space back. What I'm gonna do is just create a small incision in her hairline over here. We will dissect out this whole area, and then we will be able to place a suture to lift that brow up on both sides and give her a more refreshed appearance. Okay, I'm just gonna start by numbing the area we're gonna make the incision. I usually shake the person so they don't feel too much discomfort. So we have actually done one side. So you can see this side's been pulled up and this side hasn't. This is all swelling, by the way, just from the lidocaine that I injected. So now we're gonna go ahead and kind of lift this side to match. So what I do when I make the incision is I actually do it at an angle, so we're respecting the hair follicles and how they grow. So now what we're gonna do is I'm just gonna dissect with scissors in a spreading motion down to her temporalis fascia. That's one of the muscles of chewing. So that's why I keep telling her bite down, bite down, bite down, because I can see exactly where I'm at. Starting down to that muscle. All right, so basically we've taken a bite of the fascia there, and that's the one that we're gonna use to sort of give us a lift. And we're gonna tie it higher up. Try to go back as far as I can on that temporalis fascia, just to get as much upward pull as I can get. And you can see that's where the lift comes from. We got a bunch of lidocaine splitting out. TMI. And I always check after this part to make sure we have symmetry and that we're happy and both sides are lifted equally. I even hand the mirror to the patient so that they can be part of it and make sure everybody's happy. All right, so now what I'm gonna do is take the posterior scalp, pull it forward, and see how much of that I wanna remove. So I'll just make a little back cut in there. Whoever says this isn't arts and crafts doesn't understand. It's total arts and crafts. We're gonna staple it closed now. And I love the stapler because it doesn't suffocate the hair follicles. People don't end up losing hair, whereas sometimes sutures can affect the blood supply to the hair follicles. And these will stay in about 10 to 14 days after. So I'm just gonna get her all cleaned up and we'll be ready to go.
So different. I am just in shock.
Wow. Life-changing procedure.
Yeah, because I always look like I'm Debbie Downer. Like,
I know.
all done.